AIDS caused by HIV is there in the CBSE textbook. Gonorrhea is caused by Neisseria gonorrhea is not there in the CBSE textbook. So we told there and not there in the CBSE textbook. What is there in the CBSE textbook? That example we already told AIDS and genital warts, that you study, other things you ignore it, right? So now if you're coming for the sexually transmitted disease, I already told you a number of time these many number of microorganisms, chlamydosis, okay, hepatitis B, virus, gonorrhea, okay, trichomoniasis, syphilis, herpes, and even papillomavirus, genital warts, AIDS, etc. So all these particular diseases spreads very faster if they are having illegal sex. So here each disease is having the own symptoms, complications, and the treatment. Complications in the treatment. So so some are curable, some are non-curable. Like this, we already told you. If you are seeing the picture, okay, for your better understanding, okay, can you see this human herpes virus, human papillomavirus, herpes disease by herpes virus, papillomavirus, genital warts, syphilis causing bacteria, okay, Trypanosoma pallidum, okay, hepatitis B virus causes hepatitis B disease, HIV causes AIDS, right? Like this is what we told a number of this is chlamydosis is caused by chlamydia bacteria, Neisseria gonorrhea is a bacteria which causes gonorrhea disease. All these are all the sexually transmitted disease, invades the human body very faster if they're having illegal sex, right? So now we are coming for the next major segment is transmission. So sexually transmitted through sexual activities involves exchange of the body fluids such as semen, vaginal secretions, and blood, right? So vaginal secretions, blood, and then semen, like this we told you, right? And skin to skin contact. So all these are all the places where the microorganism spreads very faster, right? The symptoms, of course, we know very well the unusual discharge of the body fluids, itching sensation, rashes, flu-like symptoms. All these are all the symptoms which causes severe issues, in the particular individual, right? So now we are entering into testing and diagnosis. Many sexually transmitted infection can be diagnosed through, we are diagnosing through laboratory. Uh, in the laboratories, not only blood test, urine test, stool test, and also the skin evaluation will be executed to understand the disease, right? In the treatment, basically, the medical treatment will be given by antibiotics. We know very well antibiotics are not advisable for the virus infection. Why? Because it is worthless. Antibiotics we can give for fungus infection and the bacterial infection, not for the virus infection, right? So then for the virus infection, we are giving instant antibody. So some viruses are kept in control in terms of population size. I can stop HIV multiplication, but I can't kill HIV. Okay. Whereas I can kill even papillomavirus, and also I can stop the multiplication of human papillomavirus, but I can't kill HIV, right? And hepatitis B, also killing that hepatitis B virus is very, very difficult task for us, right? So, so that is the reason why curable and non-curable category we given. Okay, now the prevention method. In the prevention method, the we know very well the safe sex by using the condoms correctly can significantly reduce the risk of sexually transmitted infection. Vaccines are also available for some sexually transmitted infection like human papillomavirus. Okay, vaccination in the sense in the vaccine it is having the killed microorganism or else inactive microorganism. So I'm keeping K for your better understanding and then I for inactivated microorganism. So inactivated and killed microorganism are the part of vaccine, which brings very good vaccination support. to immunize the particular human body, right? Long-term consequences. Sexually transmitted disease leads to serious health problem like infertility, chronic pain, organ damage, and risk of HIV transmission, right? So, if you're talking about infertility, means there is no chance for having the child. Like this, the concerned couple should not think the impotency will be reversed if it is mild or moderate. If it is very severe, then only we can't reverse the infertility, right? In most of the cases, we can reverse it. Partner notification. Here, it is very important to inform the sexual partners so that they can get tested and treated with the necessaries. Uh, for example, I am thinking that this particular couple, being a gynecology doctor, I am saying this particular male is having the less quality of sperm cells, and then the erection dysfunction is there. So, to improvise the sperm count and to solve the erectile dysfunction, first I am understanding the hormonal quality and quantity in addition to the sperm and urine analysis. After examining the body organs, being a gynecology doctor, I am giving the appropriate advice, right, to the particular patient. So, this information we should structuralize as an answer for the patient, for the answer for the patient or answer for the exam. Answer for the exam. We need to narrate appropriately, point by point. Okay. So the concerned important couple is taken to hormone examination. If the hormone deviation is there, for example, if the androgen level is less, the sperm count is very less. That alone is not a reason. Might be the luteinizing hormone is an issue, might be a follicle stimulating hormone is an issue, might be LH is an issue, might be FSH is an issue, maybe androgen is an issue. Androgen or follicle stimulating hormone or luteinizing hormone, any one will be the issue. So we need to find out exactly which hormone is defective. The sperm count is less, might be LH is the reason, luteinizing hormone is the reason, might be follicle stimulating hormone is the reason, might be androgen is the reason. So pinpointing the exact hormone deviation and giving the appropriate treatment is very, very important for the proper treatment. And now education should be given in the not only in terms of teaching or audio visual aid, not only by pamphlet, not only by giving many dramas and videos, it also should be narrated with a serious proverbs, and that should be followed. Okay, so that what the population explosion will be solved like this. I am not saying, I am saying about we need to solve the STD first, sexually transmitted diseases. We need to solve it. Okay, so before entering into the infertility, we'll be going for a few more question solving session. First we'll go for worked examples that we already discussed. So this Lara should visit the healthcare clinic for understanding the sexually transmitted disease. For example, this Lara had a health issue. Like this, she is thinking why, because the concerned male had a heavy drink in the social get together, had a multiple sex partner interaction, and then finally he interacted with me. If that is a probability, what type of chance for getting the sexually transmitted disease? Instead of thinking like this, better to go for examination so that what the issue will be resolved. Why? Because in most of the cases, if you're understanding the STDs infection in the primary level, treatment will be very easy for us, right? So that is the reason why what testing the body is very important. Okay, in terms of clinical parameters, in the sense blood, urine, motion, and in the body parameters, we need to check it. And now we are coming for the other examples. Which of the following STD is caused by a virus and cannot be cured but can be managed by antiretroviral therapy? Antiretroviral therapy means what? We know very well. The HIV treatment will be done by antiretroviral therapy. Okay, we can't stop the HIV existence. Okay, we can stop the HIV multiplication. Okay, I can control HIV multiplication, but the same case, If you're talking about a case of syphilis, gonorrhea, and all, I can control. But in HIV, I can't control. So these are the worked examples. Okay, which of the following STD is caused by virus? Can't be cured. So HIV can't be cured, right? So why? Because this HIV is completely bringing the entire defense mechanism in its control. So that is the reason why we can't cure, right? And now we are coming for the next important phase is the example 3. Maria is pregnant and has syphilis. The risk of the mother to child transmission of the syphilis. What can be done to prevent them? Of course, here the syphilis treatment will be done, and it will be cured, and we can stop the entry of the syphilis causing microorganism, which is not given in the CBSE textbook. But again, back I'm repeating, the microorganism name is Trypanosoma pallidum. Okay, which spreads very fast with the help of dead cells, which is existing in the urogenital tract of the male as well as with the female. So in the genital tract of both male and female, dead cells or pus cells is giving a very good nutrition medium for this syphilis causing microorganism to enter very faster. That name I already told you, Trypanosoma pallidum, which is not there in the CBSE textbook. But the example why we are saying for you, why? Because to be very familiar, and also we should narrate can be cured, if it is mild and moderate. But if it is severe, we can't cure it. Which of the following STD is caused by protozoans parasite? We know very well the protozoan parasites leads to itching and discomfort in genital area, right? So this trichomoniasis, the word they given in the CBSE textbook, Trichomoniasis vaginalis, that is the species name, they are not given in the CBSE textbook. So, but we given the genus name and species name, but not in the slide. I am saying verbally for you. So I need to become a doctor.